It's also called exclusion zone water. And so because it excludes everything that's not it, so it pushes things away from it, kind of protects the lining of the artery. And so, but that can get broken down. And if that gets broken down by things, then that can push things up against the lining of the artery, and that can damage the lining of the artery. And so things like that can do that are like heavy metals or endotoxins, or psychological stress can do it. BPA can do it. Damaged, things that are damaged by glucose. Lots of different things can do it. And then if you're insulin resistant, that impairs the ability of the lining of the artery to repair itself. So if you have this damage happening and you're insulin resistant, then it's much more likely that damage is not going to be able to be repaired, and the body has to do something else, which is deposit clotting tissue. Now, when that happens, it can happen anywhere in any artery, and we see it in lots of different places, but it's more likely to happen in places where there's more pressure, or there's turns in the artery, or bifurcation where the artery splits and things like that, because things are more turbulent there, and there's more pressure, and things can get pushed up against the lining of the artery, more damage can happen. When it happens in coronary arteries, which it happens most often in coronary arteries because those are the arteries under the most pressure because of a contracting, moving heart. And because when it comes out of the heart, it goes straight into the coronary arteries. So it's the first thing that hits there. So the pressure is more. But when that happens there, we get these lesions, so to speak, these stenoses. And that's what everybody's freaking out about. You get this stenosis. And this narrowing of an artery. And, in the book, I talk about the collateral arteries, how Dr. Beraldi found that anywhere that there was a 70% or more stenosis of a coronary artery, the body built a network of collaterals around it that totally bypassed it, and totally compensated the heart with blood. And I found studies that show that at least in animals, other mammals, that those collateral arteries can form within 4 days. And another study showed within 7 days, so pretty quickly. And that explains why when we go in and we treat these lesions with a stent or a bypass surgery, the long-term research on those procedures show they don't work. They don't prevent heart attacks. Why? Because the body's already built collaterals. So if you go in and treat that lesion, it's not really going to make a difference. And that's the point. They don't work. The other thing is that so I guess the most dangerous stenosis to have would be that 50% stenosis where collaterals haven't, 60% stenosis where collaterals haven't started to form yet. And, then you're at risk of changing blood flow patterns because of that narrowing, and things like that. And then the medical thinking is that these stenoses, which are not full of cholesterol in the first place, they're clotting tissue, but these stenoses are, when they're soft plaques, they're vulnerable plaques, right? That they will rupture because there's inflammation or there's blood flowing past it, and it'll rupture, and that rupture will cause a clot to form, and it'll block the area, or some piece of it will break off when that rupture happens, and it'll flow down to a smaller artery, and it'll block an area, and you get a heart attack. You get restriction in blood flow. However, there's a study done in 2015, a research article where these scientists looked at all the evidence for this vulnerable plaque theory, where it ruptures and causes a heart attack. And when they looked at all the research on it, they concluded, well, they named their study "The Myth of the Vulnerable Plaque," because they basically found no evidence that when a plaque ruptures, it causes a heart attack. And this was in animal studies, and then in human observation studies and things like that. And I can't tell you how many people have come to me and said, I had a heart attack and I had no blockage whatsoever. And so they found in that study, when they looked at all the evidence, that they really concluded that when a plaque ruptures, a heart attack occurs 0.06% of the time, which is almost never. And so all these things are just poking holes in this theory. Now, it's very profitable to place stents and do bypass surgeries. I know that from personal experience, but it's not fixing the problem. It's like the elephant in the room, which is what Dr. Seema Holter talks about. It's like the elephant in the room is that these procedures don't work. Treating a lesion doesn't work. And And so then the question is, what causes heart attacks then, right? And there's a few different things that can cause heart attacks. In the book, I talk about how we can get these metabolic heart attacks where there's imbalance in the autonomic nervous system. We can get this forced shift in metabolism that can lead to tissue death. But what happens when there's a heart attack with a blockage is spontaneous clotting. Clotting that happens, no lesion has to be present. It could happen near the lesion because the lesion is changing flow dynamics. It's like, you've got a tube and you've got something on the side of the tube. And if water's flowing past it, it changes the way it flows because there's something there on the inside of the tube. And so that creates more stagnant blood. It creates turbulence, which if we're in an inflamed state or we have poor blood flow, then that can lead to clotting. And there's all this evidence of increased inflammation and stasis or stagnant blood flow. They call it resident time in an area. And the more time that the blood spends in an area, the more likely it is to clot. So if we have blood flow issues, along with this stenosis, then those things can happen. But it can also happen, like in my case, there's no stenosis whatsoever, and just a spontaneous clot happens, which to me was due to stress and inflammation and things like that. So yeah, I mean, that's kind of the story. That's all the stuff that I found, talking about cholesterol and why everybody's concerned about it, all the way up until the things that actually cause heart attacks. That's the story. I may have missed a few things, but I'm sure people can ask questions or something.
Yeah, we'll end up and allow time for Q&A.